So, what happened? Where are we?
In April, the University of Missouri-Kansas City and the Mid-America Minority Business Development Council hosted the final in its series of 3 scheduled community conversations on healthcare reform.
And one of the things that's very clear, and there's not an exception to this, is that we need to change the system. I think everyone agrees it needs to change, but it's how. And now we have a bill. What do we do with it?
The focus of this discussion revolved around the historic passage of the National Healthcare Reform Law and how it will affect the administration and delivery of healthcare services in the United States.
So one of the triads that make health policy making interesting or challenging is the triad of cost, quality, and access. Any kind of health reform, any kind of health policy change, you sort of juggle the 3 elements of that triad, because when you try to address that, the other side sort of starts to get out of hand.
Experts explored some of the myths and misinformation surrounding the new legislation, including the potential for legal challenges stemming from those who oppose the legislation.
This would be a very striking thing for anybody to do, because it's this odd notion that the federal government can't change its mind in any of its spending decisions if it has state involvement. So that one, I think, is not going anywhere. They can't opt out of the law as a whole, but they can opt out of doing the work that's involved that they say is commandeering.
Thanks to all who participated in this important series of discussions and plan to join us for the next UMKC Community Conversation.